Hi, my name is Cheryl and this is Rachel. We are speech-language pathologists at Gaylord Specialty Healthcare in Wallingford, Connecticut. And we just wanted to talk to you a little bit about our experiences using the Passy Muir speaking valve. I think one of our biggest challenges is when patients come here, they're in a new environment, they're coming from acute care. And if they don't already have a means of communication, they're ventilator dependent or they have an open tracheostomy tube, they're very nervous because they need to get their wants and needs out as quickly as possible. And it's our job to make sure that that happens for them. So what we try to do as soon as they get here is to start them on the Passy Muir valve as soon as possible in order to see if they have adequate voicing in order to make their needs and wants known. We work as part of a team with the MD and respiratory, and we all come up with a conclusion whether or not we think that this patient is a candidate. And if they are, then we start immediately, whether they're on the ventilator or off the ventilator, in getting them to use the Passy Muir speaking valve.
And sometimes initially it's quite challenging for the patient to use this new device. They spend weeks and sometimes months without a voice, breathing through their tracheostomy tube or a ventilator, and they need a little bit of coaching and a little bit of professional guidance to maximize that voice production. So oftentimes we will work with the patient on breath support, how to take enough air in to get that voice out. Sometimes we will consult with pulmonologists or the respiratory therapists, and we might need a different tracheostomy tube in the neck to maximize that voice production. Once that's achieved, then sometimes we will train family members, and we'll also train the patient themselves to put on and take off the speaking valves to help maximize independence with the Passy Muir valve.
I think it's amazing once the patients actually do feel confident in using the speaking valve. It's amazing what you see emotionally, physically, psychologically.
Yeah.
It's huge for them to be able to have their voice again. You don't realize what it's like, not to be able to communicate until you start working with these patients. And it's so frustrating. They usually rely on mouthing. And the general public, as you know, even speech pathologists sometimes have difficulty reading patients' lips. So you just see the frustration on patients' faces, and when you take that away by allowing them to use the Passy Muir speaking valve, it's just a wonderful, wonderful experience for them and for us as therapists.
Great morale booster. I have to share a story. I had a patient a while back, very depressed, very ill, just feeling down all of the time, had minimal participation in her physical therapy, her occupational therapy, didn't really make many attempts to mouth even. I told her one day, a couple days after her arrival, that we were going to try a new thing, the Passy Muir valve, and she agreed to it. I put it on her, and she went from 0 to 60 miles an hour. She sounded beautiful from day one, and she kept saying to me over and over again, "Rachel, I feel like it's Christmas Day. I feel like it's Christmas Day." And a spark was brought back into her life. And from that moment on, she had it on all day, every day, and she loved it. She loved it. So it definitely had a great positive impact in her recovery.
All right, Helen. I'd like to teach you how to put your speaking valve on today, your Passy Muir valve. That'd be good, right? So, what I want you to do first, can you see yourself in the mirror? Yes? You can see this, you can see your trach tube and your trach mask. Okay. What I want to do is I'm going to show you how to first put it on. The first thing I'm going to do is I'm going to gently put this trach mask off to the side. I'm going to take 2 fingers and I'm going to hold your trach tube taut like this. Okay. I'm going to take my other 2 fingers and I'm going to do a gentle twist towards the right, okay? Gentle twist on towards the right, and then I'm going to replace your trach mask on. So now your speaking valve's on. You want to say hello?
Hello.
Sounds good. Easy enough, right?
Yes.
The most important thing to remember when you put your speaking valve on is to do a gentle twist. You never want to put it on too tight.
Right.
Okay? Now to take it off, believe it or not, you turn the speaking valve in the same direction. So for me, it'll be a gentle turn to the right. For you, it'll be a gentle turn to the left. Okay? So let me show you how to take it off. We're going to put your trach mask off to the side. I'm going to hold my fingers taut on your tube and do a gentle twist off. Okay? And then trach mask goes back on. You want to give it a try? All right. Good job. Good. Excellent. It's on. You want to practice taking it off now? Perfect. And the last step is replace your trach mask. Good job, Helen. Nice job.
My name is Helen. I got the trach mask in my throat. Before I got it, I couldn't talk. And it was very frustrating for people to understand what I was saying. A lot of them used to tell me to shut up. Oh, wait, Ellen. Write it down. And that's aggravating. So when I learned about this, I was happy. And now I can talk. And it feels good. It takes time, patience. But patience is a virtue. You enjoy having to hear your voice.
Thank you so much for listening to us today. We hope you got some information about what we do here at Gaylord Specialty Healthcare when it comes to the Passy Muir speaking valve. If you have any questions or any comments, any feedback, please feel free to contact us at Gaylord Specialty Healthcare in Wallingford, Connecticut. The phone number here is 203-284-2800, and you can ask for myself, Rachel, or Cheryl from the Speech Pathology Department. Thank you so much. Take care.
Thank you. Bye-bye.